It is very important to wash your hands thoroughly before handling feeding devices. Bolus feeding can be done using either the 60 cc catheter-tipped syringe or a gravity drip bag. When using the syringe, fill it with water and attach it to the bolus port of the feeding set. Make sure the tube is unclamped and flush with water to pre-fill it. Reclamp the tube after pre-filling. Remove the safety plug from the mini balloon button feeding port and attach the bolus feeding set. To attach the feed set to the mini balloon button, line up the black mark on the feeding set adapter with the black mark on the button. Make sure the feeding set adapter is pushed in completely and gently turn clockwise at least 1/2 turn, but no more than 3/4 turn. The adapter will run into a stop when it reaches the 3/4 point. Do not attempt to rotate the adapter past the 3/4 stop, as this may damage it over time. If the adapter does not rotate freely when first inserted, make sure the adapter is pushed in fully and that there is no debris blocking the feeding port. Next, disconnect the syringe and remove any remaining water in it. Remove the plunger from the syringe and reattach the syringe to the blue single port. Slowly pour the formula into the syringe and unclamp the feeding tube. Be sure to keep the syringe filled until the prescribed amount of formula has been given to prevent air from entering the stomach. When the syringe is almost empty, add the amount of water prescribed by your healthcare provider. Once you are finished, clamp the feeding tube and disconnect the syringe. Reinsert the plunger and fill the catheter-tipped syringe with 5 cc warm water for children or 10 to 20 cc warm water for adults. Unclamp the tube and flush it with warm water until it is clear of formula. Remove the bolus feeding set by rotating counterclockwise until the black marks are realigned and gently disconnect it. Then reinsert the mini balloon button safety plug into the feeding port. To bolus feed with a gravity bag, slip the Christmas tree adapter of the gravity bag into the bolus port of the feeding set. Fill the bag with the prescribed amount of formula and purge the air from the tubes by opening the bolus feeding set clamp and allowing formula to flow. Close the bolus feeding set clamp when the formula reaches the straight feeding adapter. Attach the bolus feeding set to the mini balloon button feeding port as shown previously, and then open the clamp. When the gravity bag is almost empty, add the amount of water prescribed by your healthcare provider. Clamp the feeding tube and disconnect the gravity bag once you are finished. Fill the catheter-tipped syringe with 5 cc warm water for children or 10 to 20 cc warm water for adults. Flush the bolus feeding set with warm water until it is clear of formula. Gently disconnect the bolus feeding set and reinsert the mini balloon button safety plug into the feeding port. Regardless of which bolus feed method is used, it is recommended that the patient be kept with his or her head elevated for at least 30 minutes after feeding. If medications need to be administered, they must be in liquid form. Diluting thick liquid when possible will help prevent the mini balloon button tube from becoming clogged. If a medication is only available as a tablet or capsule, check with the pharmacist or physician to make sure it can be crushed and dissolved in water. Be sure to flush the tubing and mini button with warm water after each dose of medication.